I'd like to invite our first speaker, Dr. Kassem, who some of you may know. He spent a good number of years here in Ottawa. He's a trauma and bariatric surgeon who practices in Canada. He received his medical degree in Damascus and then left Canada to complete his, Syria, and completed his general surgery training here at the University of Ottawa. He did a clinical fellowship in Foothills in Calgary, and after showing some great leadership skills in trauma, he was offered the position of trauma team leader at the Civic Hospital at the University of Toronto. Dr. Kassem has extended his surgery skills and expertise by earning an MIS Bariatric Surgery Fellowship at Baylor College of Medicine in Texas. He's been active in many humanitarian organizations, co-founder of the Union of Medical Care and Relief Organizations, which started in 2012. He is currently the chairman of Awesome Canada, and he's also initiated the electronic data registry system that's being used now to advance patient care and research in Syria. Despite the war, we're able to get data out. And he continues to be involved in the medical missions to support over 80 hospitals across Syria. Please welcome to Dr. Kassem.
So thrilled to be among you here in Ottawa. I graduated from Ottawa in 2006, and so happy to see some of my colleagues and mentors, Fadi, Shahir, and many others who here who trained me more than 10 years ago. So I'm going to just give an overview about our organization, which you've seen some slides about it briefly. We have started in 2012. We founded the organization early 2012 as a response to the medical crisis and the war in Syria. And this has been going now for 5 years in a row. Yeah, so Awesome is a nonprofit organization. As you've seen and as mentioned, we have a collection of medical organizations all over the world, from Germany, France, Netherlands, Switzerland. We had a charity in Turkey as well, and we just founded our organization in Canada just a couple of years ago. I want to start by thanking Dr. Pete. He was supposed to be with us today. You've seen him on the flyers, but unfortunately he had a bad health issue. Just a few days ago he was hospitalized. So Dr. Pete is the chief medical trainer in Syria actually. He's been many times to war zone areas, to Aleppo, to Idlib, to many areas, to Lebanon, to Daraa. So, and he has been fantastic in providing training to students, nurses, paramedics. He's just a fantastic guy, and we really miss him today, so wish him really a speedy recovery. I want to thank the great surgeon, Dr. Nod, who is with us today. I learned from him a lot. I went to Foothills for a year, and I saw one gunshot in Foothills Hospital. And I remember as a fellow, I rushed to the emergency room, and there were lots of staff waiting over there. Gunshot. And, unfortunately, the patient was dead. He had a gunshot in the head. That's the only gunshot I saw in Canada, basically. It's all blunt trauma here, as you understand. So since I started going with David, with MSF, with Red Cross, I learned a lot about penetrating injuries and gunshots and blast injuries. So we're really blessed with Dr. Nod being with us today. And with his training and his compassion, he's been to Syria several times into the war zone. And he told me today, I want to get in again. I told him that it's really dangerous now. Lots of ISIS people over there. So, but his heart is there, really. So we're very thankful to have him among us. I want to thank a few organizations, governments, to start with University of Ottawa for allowing us to organize the event and for hosting us in the morning, particularly Dr. Fadi Bella and Dr. Sanderson. Unfortunately, he apologized he couldn't make it. He's out of the town. I want to thank the Canadian government, not the previous government, the current government, with all respect. No political, but we tried hard with the previous government and we got nothing. I'm telling you the truth. We got nothing, zero. And our partners, the awesome partners in France, in Holland, in Germany, they get lots of funds, tons of funds, millions, directly, checks from the foreign ministry. We got nothing from previous government. Now, the current government promised us they're going to change things. We haven't got anything yet from them, but it's promising because they started funding the refugees. We've seen lots of movement recently. But just don't forget that they brought 25,000 refugees, which is a great initiative. We still have 6.5 million displaced inside Syria. We cannot bring to Canada or to Norway or Germany 6.5 million. There's no way. Lots of illnesses, chronic illnesses, injuries. Dr. Dave is going to talk about the injuries over there. So we cannot bring them. Turkey has been hosting millions of them, Lebanon. But there are lots of people trapped inside. We have to provide them with the healthcare inside Syria, so we cannot really forget about them. Special thanks to the Turkish government. Honestly, without Turkey, we can't operate. Frankly speaking, Lebanon, Jordan, everyone just close the doors. The only country which allows us to operate is Turkey. We have our headquarters in Turkey. We can get the medical supplies. We send convoys from Canada. We get lots of supplies donated from many hospitals within Canada, many NGOs. So thanks to the Turkish government for allowing us to do that. And then the many NGOs, I didn't mention them here because we have lots of them, but among them, I'm just going to mention like Human Concern. We have the previous executive director of Human Concern, Mr. Aftariz. They did an amazing job whenever we ask them for funds. We have MSF, we have HPIC, many other organizations been very much supportive to our cause. So thank you very much to all these organizations. The awesome supporters, the physicians that have been supporting us throughout the last 4 years, without them we could not really have made it. And special thanks to the volunteers. Please stand up, our volunteers. Avi, Claire, Sadia, Safwan, and Becky. Great people. So honored to work with you. So honored to work with you from day one. All the organization, all the gathering, the events, they spend times and hours and efforts every day to make this happen. Thank you very much from my heart. And then the great doctors on the ground. Don't forget about them. Without them, we can't. Because I can go so much, and David can go so often. But at the end of the day, we need to train them. They're going to stay there. They're going to provide the patients, the injured patients with the care. So they are the great, really heroes behind the scenes. So very, very much thanks to them. These are some numbers, just to give you an idea about what we have accomplished in the last few years since we established the organization. We've seen more than 1 million visits in the primary healthcare centers. That's just to imagine how many displaced people are still stuck inside Syria. About 9,000 people trained by people like Dr. Pidi and Dr. Nash in terms of medical staff and nurses. 29,000 surgeries done in our hospitals. And then 128,000 patients mentally ill being provided with psychosocial support and treatments. We have 5 divisions. The first one is the trauma and hospitals. I had the honor to head this division for 2 years, 2014, 2015. More than 120 hospitals being supporting with medical supplies that we sent from Canada all over the world. 130,000 surgeries we were able to run with the medical supplies, and over $13 million we gathered in the last 4 years to send medical supplies and equipment. The largest trauma center, I had the honor to establish this with 3 other colleagues, one from Britain, Dr. Munir, and Dr. Ahmed from France. It became now currently, it's a dream, became the largest trauma center with a CAT scan, 8 ORs, full ICU, tele-ICU connected with Canadian intensivists and American intensivists. A great project, and we see about 14,000 patients a month, more than 1,000 trauma. And David's going to show you what the trauma surgeries in Syria like. More than 1,000 trauma surgeries a month we do that in that hospital. And then we have some ambulances that 10 ambulances actually, that they go from village to village under a fire, very risky. And then we have the second division, the primary healthcare division. We've seen, as I mentioned, about 825,000 patients, more than 1 million consultations. We have mobile clinics because there are areas difficult to reach. They don't have a well establishment. They don't have a clinic. So we send the mobile clinics to them to provide them with primary health care services. The mental health care division is a big thing. We have a full group in Edmonton. More than 128,000 patients have been seen. Many of them, you're going to be surprised, are seen over the internet, telemedicine. And that's been a great project. We reach schools, we reach camps, provide services to the medical staff. Many of the medical staff are really suffering from post-traumatic stress disorder. And then the fourth division is training qualification division. We have seen or done more than we have done more than 120 courses and about 9,000 trainees all over between medical and trauma. The research department has been established a couple of years ago as well. We do surveys as well because it's hard to distribute the medical supplies with the very limited resources we have in the country. So we have limited resources in terms of the supplies, in terms of the funds, in terms of the physicians that in the country, in order to know how we're going to distribute the supplies, where Dr. Nod or the great surgeon is going to go in order to provide the training and supervision, where the surgery should be done, where the surgery should not be done. We needed this kind of research. I'm going to just kind of over some trauma data in the second portion of my presentation. So we established the trauma electronic medical records, and initially, in 2013, when I told the surgeons that we need some data, we don't know what's going on in the country. It's a big mess, and they said we never had data with Assad, with the previous government. How are we going to have it now under fire? And I said, if we don't have it, the NGOs and the donors won't be able to know how they're going to supply and what they're going to send, and we don't know exactly what the outcomes are. So we started collecting data from hospitals. We started our hospital and then went over to many hospitals. We were able to go to over 99 hospitals. And this is how we're doing in 2013, really struggling, going from hospital to hospital, as if you're really running and not really achieving anything. But really, what doesn't kill you really makes you stronger. At the end of the day, we became really much more knowledgeable about how to collect data in a war zone and how to reach the hospitals and how to train the staff to collect the data. And everything is really doable if you have the knowledge. We collected more than 200,000 injuries. That's our own data. So imagine how much injuries and trauma cases there are in Syria. That's only since 2013. So in two years, more than 200,000 injuries. We did some analysis with the help of Yale University, and we expanded this to other primary health care divisions and the mental health as well. So more than 99 hospitals as an average were able to include in the data. And the average cases, or the median actually, cases 500 among 9 provinces all over the country. Here are the distribution of the 99 hospitals. You will be really surprised with the numbers. These are recent numbers. This is just the published end of 2015. You have more than 148,000 patients visiting emergency departments in the areas not controlled by ISIS, not controlled by the government. All that data is not really coming from the government area, which is usually safe, or ISIS area. These are areas being airstrike every day. 148,000 visitors to the emergency department every month. Another striking really figure is that when we figured, who is really being funded and who is not, 41 hospitals have no funds. They're volunteering for the last 2 years, the staff, and that's not sustainable. These can collapse any day. It's going to be catastrophe. 31 have sustained support by, MSF, Red Cross, our organization, or someone else. And 41 has partial support. But 41 hospitals that are operating voluntarily with no supplies or no actual financial support. That's what it can get. So this is the trend of the injuries from 2013 to 2015. This is per day. The injuries coming to the hospital, not the surgeries. So it used to be in the range of, 100, maybe 200 cases. And then all of a sudden it goes up to about 200 and then 300 cases. That's in early 2015. You see peaks up and down. And that really reflects, unfortunately, when they're going to throw a bomb or a barrel bomb on the hospitals or on the civilian areas. So that's why it's fluctuating up and down all over the country. This graph is going to show you the injuries by mechanism, by gender. You'll be surprised initially, and Dr. Nazmi is going to talk about this today, is we used to see loss of gunshot, but now we see loss of blast injuries and loss actually of shrapnels. And that's because of the buildings being shelled and falling on the people. So lots of blunt injuries currently, lots of shrapnels as opposed to simple gunshots, which is here only a very small portion. This graph shows you the trauma volume per facility per month. So we can capture currently with the facilities that are reporting to us in each province. That's the average in each province per facility per month, 655 trauma cases. So we can see that Aleppo really deserves more supplies and training because they really see a high volume of trauma. And then rural Damascus comes next. That's over 2 years as an average, and then maybe Idlib and Hama. So we can figure out which really province is being hit badly and which one of these provinces need urgent help and more supplies and more financial support. And these are the major surgeries per province. So you can see in each area how many surgeries being done on a monthly basis. And again, Aleppo is really the peak with more than 1,400 major trauma surgeries that, none of the major trauma centers in the world can take that number on a monthly basis. And then you can see Damascus suburban and the other provinces. This slide shows you, unfortunately, the death within the hospital. Most of the injuries, unfortunately, they don't arrive to the hospital. They die beforehand because of major thoracic injury, major brain injury, as Dr. Nam mentioned today in the grand rounds. But these are the deaths within that we could really capture within the hospitals after being admitted to the emergency department or to the emergency department. This is the death here, and this is the total number of the trauma up here. The dark is the male gender and the light is the female, but what's really striking is that from 0 to 18 age groups, a huge number, they're not really much less than those over 20, actually. I mean, yes, 20 to 30 reflects the young population, but then look at that, over 30 years versus less than 20 years. Actually, most of the deaths happen actually with ages less than 20 years, and that reflects that this is not really a civil war. Airstrikes killing people because how the kids are being killed every day. This is not really a fighting on the ground, because it's fighting on the ground. You're going to see more gunshots. You're going to see mainly just that age of group being killed, but you can see lots of people being killed because of airstrikes and major destruction. We do have challenges with gathering the data and doing the analysis. Documentation of complications is not a habit in Syria to start with before the war. It's going to become much more difficult even after the war. People, they have no blood supplies, and they have no blood bags, they have lots of shortages, and you're going to tell them, I want to gather data, I want to train you, I want to get data from you. And always they tell us, why you're gathering this data? Just give us the supplies, give us the money. So it's not easy, and really to document the complications, we don't know most of the death, why it's happening. We believe it's bleeding, could be infection. We don't know if there's high figures of PE. We don't know really exactly what's causing the high volume of death, especially in the younger population. To train the staff to better understand the data collection and what's beyond it is really not an easy job, although we have improved a lot in that. And in terms of the greater coverage area, we have no access to some areas under siege, difficult areas, risky areas, so we need to access these areas so our data will be more meaningful. And at the end of the day, this is a kid that took this picture in Bab al Hospital, or hospital in northern Syria. It's really great feeling to see that you can, get this kid out of the hospital healthy with a smile. We need not only to save the patients, we need to save them with a quality of life. And without data, without knowing what's causing death and where's the problem, where the training is missing, we can't really improve the quality of care. And that's the ultimate goal to get these patients safely and on their feet, not just without any quality of life. And it's really rewarding that many of the surgeries that we did, the patients and the kids were able to join their families back, and we lost many of them at the same time. So it is, what it is, but thank you very much again for listening and for being with us today, for your contributions and for your support. Thank you.